Continuing MCQs on CA breast. So the next question is best diagnostic method for breast lump is. So diagnosis of any carcinoma or a benign lesion always comes with a histopathological examination. So in the options, if you see, the first option is USG and second is mammogram. So these are radiological investigations. They can tell you there are suspicions of malignancy, but they can never give you the diagnosis of malignancy. So the first two options are wrong. Coming to the next option is biopsy, nothing but the true cut biopsy, and next is the FNAC. So coming to the differences between the FNAC and the biopsy. So FNAC is only based on the cytologies, that is the cell, and the biopsy is the tissue architecture. It will tell about the tissue architecture. This will tell whether the cells are malignant or not, and here whether the cells are malignant or not, whereas this can also tell you about the invasiveness, whereas here in FNAC you cannot assess ERPR, HER2/neu status cannot be not assessed. So whereas here it can be assessed. So the best investigation will be biopsy and not FNAC. So the next question is 45-year-old woman presents with a hard mobile lump in the breast. So next investigation is, so previously we have discussed about the triple assessment. First is the clinical examination, next is the radiological, and next followed by the biopsy or the FNAC. So in the clinical examination you have found out that it is a hard lump, and note down the age of the patient. So the hard lump is clinical examination, hard mobile lump is clinical examination followed by radiology. So the first option FNAC will be wrong, and the excision biopsy will also be wrong according to triple assessment. So the remaining options are USG and mammography. Since the patient is above 40 years, so mammography will be the preferred investigation. So the option is C. Next question is female patient presents with a hard mobile lump in the right breast. So which investigation is most helpful in making the diagnosis? So there is a hard lump, the age is not specified, it's a hard lump. So first thing which will strike into your mind is malignancy, and they are asking for diagnosis. Diagnosis means histopathological examination. So the last option of mammography is wrong, and the second one is, the first option is FNAC. So we have already discussed between the pros and cons of FNAC and needle biopsy, and excision biopsy is not preferred for diagnosis of malignancy, so that is ruled out. And when you want to choose between FNAC and needle biopsy, the most helpful would be the needle biopsy. So the option is B. So the next question is gold standard investigation for screening of breast carcinoma in patients with breast implant. So this is a straightforward question, and the option is A, MRI. Thank you.